Alright, today we're watching Madness in Medicine. This was by McGraw-Hill Films. Publication date 1977. Topics, educational film, series, Madness in Medicine. Alright, so not much to go on, but I think the title is all we really need for this one. So let's strap in. Madness in Medicine. Let's go. Oof. Already, this is going to be a tough one, I think. Already, I love the intro music they have for McGraw-Hill Films. I don't know if this is how it originally sounded, but the archival footage distortion of it really makes it sound decrepit in a way that really reflects the aged aspect of the film. That's a pretty cool effect, the sound effect on that wave.
This is what being crazy looks like. And for me, it has always said, this is the pain of madness. The tears, the hurt. The head isn't there, but the head is huge, and then it's, I don't know, it's very, This is what being crazy looks like. So everything is fighting, is bright, is harsh. It hurts.
Wow, this woman seems troubled in a way that I can't quite put my finger on. I guess I should say at the start of this that I don't really know a lot about mental illness, and I feel like I should have put a disclaimer at the very beginning of this video that they're probably going to talk about mental illnesses in a way that is a bit out of fashion. Again, that's kind of the point of watching this sort of stuff. So just go into this knowing that we might see some rough encounters with some mental illness. That was a really powerful intro, though. That this woman introducing what her thoughts on craziness are, and that painting. That was a really good painting. I almost want to try to find this painting and buy it because that really is an interesting painting. I just want to look at this painting real quick. That does kind of look like crazy. You have all this, black scratch around the face, black, charcoal rubbing or whatever, blood coming out of the nose, and very exaggerated features. It's not cubist. It's I don't know, it's almost abstract, but it's not. It's a very good piece. I'd like if somebody in the comments could tell me where this painting is now. I would really like to see this painting in real life. From this painting, I get more sad than I do crazy, but I guess that's, that's the artist speaking.
It's the most baffling of human afflictions. Its victims the most abused.
Jeez, what's going on in here? That was a weird shot. This guy's strapped to a table. I hope we learn about more about that later.
Mental illness has been with us since the beginning, yet our ignorance far exceeds our knowledge. We don't know what causes it, and we're still searching for effective ways to treat it. We even have trouble defining it. The line between sanity and insanity is blurred. It's sometimes hard to know where one ends and the other begins.
It's kind of funny that people really just thought of it in those simple terms. You're either sane or you're insane. There's not levels of nuance to any of that.
You're supposed to go to church on Sundays or temple on Saturday or whatever. You're supposed to listen for the still, small voice of God, but you sure better not hear it.
As a society, we have little tolerance for bizarre behavior, so we build huge institutions and look away.
I mean, that's true. That's unfortunate, but it is true. We just build huge concrete buildings to keep these people locked up, pretty much.
And we delegate to the psychiatrist the task of curing or confining those whom we do not wish to see. But psychiatry itself is under attack. Some within the profession think it is going in the wrong direction. Others, mostly former patients, think it harms more than it helps.
That's so interesting. I've never been introduced to the anti-psychiatry movement, but I guess in the early days, when people first started treating people with mental illnesses, there must have been some sort of pushback, which is funny because I can actually understand that through what people are pushing against today. And in the modern discourse, at a certain time, people were pushing back against the notion that some people had mental illnesses. I don't quite get the argument that people were making at this time, but it's interesting to know that people were anti-psychiatry at a certain point.
Psychiatry hasn't done anything for me but give me nightmares for the rest of my life.
To most Americans, psychiatry is a couch, a chair, a quiet room, and lots of talk, mostly from the patient. But in reality, psychiatry is much more than that. It's drugs and electric shock treatments and, in rare instances, brain operations to try to correct abnormal behavior.
So psychiatry is drugs, electroshock treatment, and in rare instances, brain operations. So kind of a different idea of psychiatry compared to what I understand it as. But again, we'll learn more about this.
It's also huge institutions, barred windows, restraints, seclusion rooms, locked wards. And underlying all this is a nagging question: what are we trying to treat? What is mental illness?
That's something I've been grappling with for the last 14 years. I don't have the answer to it. I consider myself a student of that matter, and I don't know the answer. Generally speaking, I see mental illness as being unable, not unwilling, but unable to cope with our society.
See, that's a very interesting definition of mental illness. Unable to cope with our society. Not unwilling, but unable, which is funny that he makes the distinction. But I feel like that is such a broad definition of mental illness, is the inability to cope with modern society. And note how he's not saying like the natural world or the natural order, but modern demands of the modern world.
Mental illness is a myth, a fraud, a bad metaphor, an excuse, a rationalization. It's a religious viewpoint held by psychiatry.
See, this is insane because now, today, we have people making similar arguments, but now they're saying that things are just mental illnesses. So it's interesting that back in the day, people didn't even want to admit that mental illnesses existed. They thought they were, again, exactly what he just said, like excuses. What did he say? What was his exact words?
Mental illness is a myth, a fraud.
A myth or a fraud.
A bad metaphor.
A bad metaphor.
Excuse, a rationalization.
He did say excuse, a rationalization. That's what I was trying to come up with. They think it's all just a rationalization, and everyone with a mental illness is actually just, pretending to a certain degree. It's just ironic that nowadays we say they have mental illnesses, which back in the day they didn't even recognize mental illnesses existed.
It's a religious viewpoint held by psychiatrists which says that human troubles are somehow medical in origin and medical in their solution. Now, just how poverty...
My curiosity is where he thinks these issues come from, if not a medical origin.
Unemployment, unhappiness, fights between husbands and wives, beatings of children, anxiety, alienation, just how all these problems relate to medicine and relate to illness is never stated.
What is mental illness? I don't know.
This is like the cheeriest guy to ever be speaking about mental illness.
It covers everything from people who feel slightly badly getting up in the morning one day to people who have very serious suicidal depression or who are...
See, and that's the trouble with mental illness, is it's so hard to describe that even this guy, the psychoanalyst who works in the field, can't really give you a definite answer. So, to some degree, I think we are all mentally ill, just in different ways.
So disorganized by psychosis that they can't function at all. So it covers a wide range of terms and conditions. And I think maybe... And some of it's in the patient's eye. If it gets serious enough, it's in society's eye, and it's a term, highly ambiguous and difficult term.
I'll agree with that.
There are people who can't function, and for them, the end of the line is a mental institution. There are 495 institutions in the United States, 313 of them run by the states, the others private. At any given time, about 200,000 people are hospitalized.
200,000 are hospitalized in these institutions for mentally ill people. That's insane, even back then.
All told, some 10 million Americans have been in mental institutions, and countless millions of others have sought help from various kinds of therapists. This report is about those thought to be so seriously disturbed that drastic and sometimes dangerous treatments are used. Many end up in mental institutions where it is much easier to get in than it is to get out.
I originally went to a mental hospital voluntarily, and through a series of events, it culminated in getting committed. Mainly because I was trying to get out of the institution, in which I was supposedly a voluntary patient. They told me that I was too sick to leave, and when I said that it was my right to leave anyway, they told me that it wasn't. And in New York State, they can commit you for 60 days on the signature of 2 doctors. You don't have to go to court, and that's 2 months. That's a long time, especially in a state hospital, which is a pretty grim place.
The way she said that at the end, which is a pretty grim place, that really is telling to what these mental health hospitals looked like on the inside. The story of this woman is insane, though. You never really hear about that anymore, but people just being caught inside the trap of the mental illness asylum. Like, you know, to have some sort of mental illness that's not so bad. Like this woman probably had, you know, nothing more extreme than anxiety or something, but to have been institutionalized and then trapped inside these institutions is just terrifying. Terrifying to think that so many people, this woman seems perfectly fine, and it just to see that because she had some degree of mental illness, again, probably just anxiety, her ability to cope with modern society landed her in this, you know, institution. It's just very terrifying.
Grim, isolated, lonely, most state hospitals look like prisons. This one, Napa State Hospital in California, looks like a campus. But once inside, there's no mistaking what it is.
Yeah, it's also pretty scary how much the mental health institutes resemble prisons. Like, that should tell you pretty much all you need to know about how these people are approaching this issue.
The key is the symbol of freedom in a mental institution.
That's really sad to hear. The key is the symbol of freedom.
Only staff members have keys, and unless you have special privileges, you're confined to the ward. And you're at the mercy of the people who run that ward. In many places, you can't make phone calls. Your mail may be restricted, and visitors are generally few and far between.
This place looks exactly like One Flew Over the Cuckoo's Nest. Like, I know that was set in a mental institute, but it's just wild to see how accurate that truly was.
Mark James was a patient at one such ward at Napa State Hospital after a suicide attempt.
See, that's bizarre, right? Just after a suicide attempt, you get committed to an institute and then locked up for possibly the rest of your life. That's wild that you could get locked into a mental institute for attempting suicide. Now, I don't know what exactly should be done if you attempt suicide, but I don't know if locking people up in cages is really the best answer.
I was taken to ward Q7 and 8. I was taken to a cell, they call them seclusion rooms, and locked in, fortunately.
I feel like that's the worst possible thing you could do to somebody who's going through some sort of manic episode or suicidal episode in their lives. It's just lock them completely alone in a soundless room for days on end. Isn't that just torture?
I was not strapped down onto the bed, as many people are. The lights were left on dim all night long, so it was very difficult to sleep. No one came by.
And that was supposed to make him less likely to commit suicide.
All night I was awake, so I guess I could have rolled over and died in there. No one would have known the difference till the morning. People were put into seclusion, for example, for failure to willingly take medication.
Again, that's another scary thing that was in One Flew Over the Cuckoo's Nest, is needing to take the medication and just needing to trust these random people who are medicating you for an attempted suicide attempt, which I don't know what sort of medicine you can give somebody for that. Obviously, it depends very specifically on their case, but it's so bizarre that you were just locked in this room and then force-fed medication, and if you didn't take whatever random medications they deemed you needed, you would just be locked in there longer. This is actually a very frightening look into the world of mental institutions.
Any sort of verbal abuse towards a psychiatric tech could result in a trip down the corridor, as it's called.
That trip down the corridor can be the first thing that happens to you. This is a newly admitted patient. The staff is wary.
We don't know you right now, so we're going to have to check you out first, all right?
The seclusion room is part of every mental hospital. Sometimes it's called the quiet room or the blue room.
The quiet room or the blue room? I feel like I've heard of the blue room. That's a very interesting take on it, the blue room.
I was on suicide precautions. You had a choice of either sleeping out in the hall, strapped down to a bed and wrist and waist restraints, which I just thought was horrible, or else sleeping in solitary, where I stayed for 7 months. And
She just said she stayed in solitary for 7 months.
I never in my life wanted to die so badly as when I was locked in that cell, and I did not know what attitude I was supposed to get out of there.
Again, the whole point of this is to like rehabilitate or at least like help people with mental illnesses. Like, again, that guy just committed suicide, and now this woman is saying that she never wanted to die so badly as when she was locked in these rooms.
There I was threatened as supposedly a joke that you will have to live for the rest of your life unless you get off suicide precautions. I never wanted to die so badly as an escape, as you know, a means of getting out of that room. I know that the people who did it to me had the best intentions in the world, but that does not excuse it.
Well, that's interesting that she's still... I mean, like, isn't that Stockholm Syndrome or whatever to side with your abuser or something? But that is just so bizarre that they tried to cure suicidal depression with, forced isolation.
So if I spent, from age 7 to about age 10, I spent at least half the time locked in solitary confinement. And I can remember, looking out through the bars and...
From age 7 to age 10, he spent half the time in solitary confinement. That's bizarre. How do you even get in an institute from that age?
And I can remember, looking out through the bars and wondering if I was ever going to see, ever going to be able to walk around on the outside again. And just like what you just heard, even at that age, I wished that I was dead, And that was supposed to help me, Every few days, the psychiatrist would come in, surrounded by all the staff, and tell me how I needed this. This was part of my treatment. Everything that's done to you in these places is part of your treatment. I was kept from eating. I was put on bread and water for 2 or 3 days at a time. That was part of my therapy.
Yeah, this is insane. This all just sounds like different forms of abuse now. It's actually truly wild to hear that these were the tactics people were using to try to get people to not want to commit suicide. It is truly, especially this guy said he was a kid. I don't know how they were treating children like this in a mental institute. I don't even know how a 7-year-old gets admitted into a mental institute. And again, none of these people actually seem like there is anything really wrong with them besides the fact that they might have been suicidal once.
I was torn away from my parents, my foster parents, for months at a time. That was...
Foster parents, geez, Andy's an orphan. See, that exactly, there's so many more underlying causes to somebody's mental illness than these people assumed that there were.
Part of my therapy. Every conceivable thing that's done to you there is called therapy, and it's presented to people on the outside as therapy too. And what does that do to your head? You know you're being tortured, but you're being told you're being helped. And not only that, you're being told you better say you're being...
That's true. I would actually start going insane if that was my reality. If everyone around me told me that they were helping me by doing something that seemed only torturous to me. This is really terrifying.
Help, and you better believe you're being helped, because if you keep saying you're being tortured, if you keep complaining about it, it's a symptom of your illness.
I feel like this can be applied to so many different circumstances too. Like, how often can attempting to fix something and forcing somebody to change the aspect that you perceive as their mental illness is actually what causes the mental illness in the first place?
So you have to say that black is white and war is peace in order for them to stop bothering you. What does that do to your head? I mean, you can't think straight when you're treated like that, the way they pervert the language,
That man's one testimony was really powerful, though. I can't imagine the things that he went through.
All of the hospitals complain about a lack of money and personnel. They say they would like to do more, but can't. Individual therapy is practically unknown. Institutional psychiatrists are too busy serving as administrators to see their patients.
I distinctly remember sitting outside the door, Dr. Macy's door, for like 2 hours, because you couldn't get in to see Dr. Macy. You just had to sort of sit there, and if he came out, you could catch him and say, hey, Dr. Macy, you know, so-and-so, I got to see you. And he'd say, yeah, I'll be with you, and he'd disappear again.
That's bizarre, too. You come to this mental institute to see a professional who can help you through your mental issues, and they're so overworked and so overwhelmed that you can't even get access to them. But you're locked inside of this prison until you are able to convince this doctor that you aren't mentally ill anymore. It just seems unwinnable. I mean, I'm sure there are some people that definitely did need to be institutionalized for the rest of their life, but the people they're focusing on this all seem like they kind of just got trapped in this horrible system.
So, what do the patients do? Mark James.
Life on the ward basically consisted of a lot of what I facetiously call TV therapy, because that was about the only thing there was to do.
Again, I can't help but note just how much this all looks exactly like One Flew Over the Cuckoo's Nest. Like, they really did a good job with that movie, because they must have watched this. I guess they could have, right? When was that movie made? This was 1977. I bet this had some influence either on or from One Flew Over the Cuckoo's Nest.
People would pace back and forth in the halls. There was actually very little.
This again is something I think is just an aspect of human nature. Like, if you locked people in this building for their whole lives, eventually they are just going to wander around like aimlessly, you know? Like, you're just going to break their spirit or break their minds. If their minds weren't broken already, living in this place definitely would have.
Square floor space for the number of people on the ward, and this really added to the atmosphere of tension. People would smoke cigarettes, throw the butts on the floor. For those that didn't have cigarette money, they would pick up the butts and then smoke them down.
That's something funny that I didn't really think about. All the mental patients were still just smoking cigarettes. Like, even in a mental institute, you were allowed to smoke around everyone.
To the last possible amount. A lot of people just chronically stayed in bed all day.
There is one therapy that is used on just about every patient, drug therapy. And like every other psychiatric treatment, how it works and if it works are matters of dispute.
Honestly, the more I watch this, the more questionable I do think the practice of treating people like this is. I mean, I don't know what the alternative is. You can't just put needy people like this out on the streets, but there's something so dystopian about watching this whole process go down, how people are force-fed drugs and forced into this prison-like environment with the aim of improving their lives instead of torturing them.
The psychiatric drugs were the wonder drugs of the 1950s. Thorazine, the first of the major tranquilizers, was given to several million patients within months of its introduction.
Can anyone who knows drugs go through these and explain to me, like, if they're still in use today? Because I feel like I have a sneaking feeling some of these might be, like, incredibly illegal or, like, incredibly frowned upon now. But I don't know. I'm curious. I don't know drugs well enough to say one way or the other. But they seem like the sort of drugs that might have been made illegal since then. The fact that I've never heard of any of these drugs before makes me sort of think that they might not be around anymore.
Since then, dozens of others have come on the market. There are now drugs for almost every condition. Drugs to tranquilize, even out extreme highs and lows, and drugs to lift you from your depression.
See, that's the thing, too. We were giving, like, mentally unstable people, like, just some absolutely insane drugs that we probably didn't fully understand, and that was probably messing with them so much more, too. It's just, this is such a bizarre way to treat mental illness at the end of the day, that it's insane and it's frightening that this ever happened to begin with.
The drugs couldn't have come at a better time. Patient populations were rising, and the drugs promised to slow that growth. The drug companies were quick to exploit the market. Physicians were bombarded with advertisements, brochures, and other sales devices.
I know I just said a second ago this seems dystopian, but the profit motives behind this really make it seem like none of this was even an accident at all. Like, this was all sort of by design to create a market of just drug-needing people. This is actually, like, terrifying to learn about.
The drugs quickly became the preferred method of treatment, but they cure nothing.
What they do is ameliorate the symptoms of the illness and hopefully, and even theoretically, restore a biochemical balance in the central nervous system. Now, in that sense, it's something like a diabetic that receives insulin. You can say, well, I take my insulin every day and my diabetes is in control. But if you ask me, am I cured of diabetes, I would have to say no.
But it's crazy that he's comparing insulin to all these other, like, brain-altering drugs. I don't know what any of these drugs that they just showed us do, but just based on the descriptions, like, it evens out your highs and lows. It sounds like we were messing with stuff that we didn't quite understand yet.
The drugs do seem to lessen the obvious symptoms of some mental illnesses, particularly the hallucinations and delusions of schizophrenia, but they also have serious and sometimes fatal side effects.
When I was on Thorazine, I could not read. I could not get past the first word in a paragraph. Now, I had never had this problem before, and I became incredibly worried about being able to read, and I didn't know it was a side effect of the side. I don't know, even the word side effect, as if it's something off on the side. It's not. It was the primary effect for me. You know,
Again, that's just what I'm saying. People were being prescribed drugs that had all these crazy side effects or, main effects that people weren't aware of. And these patients probably weren't even told the side effects of their drugs. They were just being served them. And if they didn't take these random crazy drugs that made her unable to read, she was considered crazy. It's just, it's all so messed up.
The effect of this drug was to not make me read. I thought it was my own problem. I became terrified that I'd never be able to read again. So it created a new problem, and then I just, began to worry about that.
And yeah, somebody with anxiety or something who's being treated with a mental illness, that's only going to damage their mental health even further.
The drugs are intended and do in fact subdue you completely because it interferes with your thinking. It makes your body twist and contort. It makes your mouth dry. If you're on...
Out of all those side effects, the fact that he added in and makes your mouth dry, that one's not so bad. It makes you tweak, it makes you twitch, and it makes your mouth dry. It's just, what a funny combination of details.
Thorazine and several of the other so-called tranquilizers, it affects your sensitivity to light so that your head, if you're out in the sun, or even under bright lights indoors, becomes very, very painful. And you experience many kinds of sensations that you have no way to explain. You don't know that it's the drugs that is doing it to you, and so you think, I must really be messed up, because look what's happening to me.
That is absolutely insane, that people were given drugs without being told what the side effects are or what they might be, which again goes back to the fact that I don't think we truly understood what these drugs were even doing to people yet, and yet we were still prescribing them to these people with mental illnesses, expecting them to help, and only accepting the cases in which they did help.
Dr. David Richmond trained as a psychiatrist and now works in a mental health clinic in Oakland, California. He writes frequently about the drugs in pamphlets and as Dr. Caligari in a newspaper published by former mental patients.
Well, hang on. Whoa. I want to read more of this letter, because if we pause real quick, it says, from Caligari to Hitler, or the shaking has stopped. Many persons refuse to take all the medication, and a recent study revealed that unbearable side effects from drugs are among the reasons. A major problem is that the drugs, and list all of them that I can't say, bring about several physical reactions ranging from uncomfortable to unbearable. To the patient, it might seem like a loss of being. One woman studied, who was 50 years old, described her reaction to the drugs. I have slowed down. I feel like an old lady. I get tired from walking around the block. I want my own personality. And that really gets at what people kind of were doing. Is there were probably just some people with mental illness, again, just anxiety or depression or some sort of not fatal, not horrible aspect of their persons that people just wanted to fix by giving them drugs. It's very clear that that can be abused and turned sour. That all comes from the trouble with tranquilizers.
Interfere and disturb muscle function, so that people who take antipsychotic drugs end up usually with stiff muscles, with muscles that are rigid, often with shaking or tremors of their muscles. They can also experience what's called dystonic reactions, where all of a sudden their muscles go into spasm. And that can also happen with the muscles of your eyes, and all of a sudden you're looking up through the top of the ceiling, and it's very painful, and you can't control it. And there are also muscle reactions called dyskinesias, where you get these weird wreathing movements and squirming movements that you can't control, or you have an inability to sit still, and you're constantly moving up and going down. And all this is drug-induced, and it's often called schizophrenia, or seen as a part of some person's mental illness, when in fact, the the person is experiencing a drug reaction.
See, that's bizarre. The symptoms of this drug use are actually the things that we've come to associate with people with mental illness. Like the symptoms of schizophrenia are actually just the symptoms of the drugs that people use to treat people with schizophrenia. That's just wild.
And the number of times that I've seen people experiencing drug reactions that has been labeled as craziness is sad.
Short of death, the most serious side effect of the drug is...
That really makes you think, though, how many people have been institutionalized just because of some reaction to a drug. This is just scaring me more than anything.
...is a condition called tardive dyskinesia. There is no known cure for it. Joseph Blunt is one of its victims. His ward psychiatrist at St. Elizabeth's Hospital in Washington, D.C. is Dr. E. Fuller Torrey.
Mr. Blunt has virtually no signs of his original illness.
I like that his name is Mr. Blunt.
No, the signs that the movements of his mouth are completely side effects of the drugs that he was on for 20 years. Mr. Blount is quite rational. He understands what's going on.
See, that's so bizarre because this sort of person I would see and think that they're crazy because of the way they're moving their mouth and their face. But that I never knew that was, a lot of that was just a symptom of the drugs that they were forced to take. Again, this is why I think watching this sort of old stuff is so valuable, because stuff like this I feel like has been forgotten or not reported on since this happened. So although I don't really enjoy learning it, it's good to know that we understand this all.
And if you're patient, he can carry on a very rational conversation with you. The movements that he makes with his mouth and with his tongue, he can't stop. They're involuntary movements. He can slow them down by concentrating on them, but as soon as he stops concentrating on them, then they come back and are more. Mr. Blount also has some movements of his diaphragm. When the diaphragm contracts, then it causes him to make sounds out of his mouth. But that's all part of the same condition. If it was not for the side effects of the drugs, Mr. Blount would, in all probability, be able to leave the hospital, at least to live in a foster home.
Few new patients in mental hospitals are aware of the side effects of the drugs.
That's just bizarre. Again, few patients even know the side effects of the drugs. So I don't know how this all happened together. Like, so many things went wrong for this system to have been put into place that you're giving these mentally ill people drugs, affecting their minds in unknown ways without even telling them, and then jailing them because of their strange behaviors. I don't know what else to say at this point.
They're rarely consulted about the treatments they get. With the drugs, it's a matter of taking them voluntarily or having them forced on you.
That's the scariest part of all, is that there was really no choice. You either took the drugs to prove that you weren't crazy, which made you crazy, or you refused to take the drugs that make you crazy, which they saw as you being crazy. So there was really no way to win, or no way to really prove that you weren't insane once you were inside this place.
I had learned, because I had been hospitalized twice before, not to fight medication. Because I had, in a county hospital and in a private hospital, I had been strapped down once to a chair and several times to beds with legs and arms. And I once tried to move my arms and it tightened the leather around my middle so I couldn't breathe, and I'm asthmatic and it didn't help any. That's when I thought I was going to die. So I didn't fight medication.
She didn't fight medication. Why? Because the other treatment they administered was even more torturous. They strapped her down, they tightened. Well, it sounds like they put her in a straitjacket with her arms behind her back or something, and to the point where she couldn't breathe. Like, it's so bizarre that, people did that. This wasn't just like some evil person. This was a doctor trying to treat a patient, and that's what they thought would help. This is making me depressed a little. This is making me unable to cope with society a little.
I was cowed, like an animal that's beaten. I was afraid. So I let them do whatever trip they decided to do on me.
Jeez, did you hear that? Can we repeat that one more time?
That's when I thought I was going to die. So I didn't fight medication. I was cowed, like an animal that's beaten. I was afraid. So I let them do whatever trip they decided to do on me.
So she let them do whatever trip they decided to do on her. There must have been some degree of like experimentation that was happening in these mental institutes. Like there's no foreseeable reason why people had to have been treated like this, especially somebody who is seemingly normal like this woman, who seems like she, again, probably just had anxiety or something.
By and large, you can't make people take them. It becomes a form of moral suasion. Do people have a right to...
Again, this guy's so happy for some reason. Even though he's talking about like force-feeding mentally ill people drugs, he's so cheery. Like, why is he smiling? That's what I'm trying to say, is why is he... He's a psychoanalyst. Is that what his job was? Dr. Jonathan Cole, psychopharmacologist. This is the smile of a psychopharmacologist. He just... I know he's saying good things, but he seems really, really suspicious. Like his smile, just the way he smiles at everything. I don't know. I mean, I'm smiling too.
By and large, you can't make people take them. It becomes a form of moral suasion. Do people have a right to be crazy?
That's an interesting question, actually. Do people have a right to be crazy? I guess that's something that I won't be able to answer, but answer this in the comments. Do people have a right to be crazy? Well, it seems like he disagrees. It seems like he was about to say, I don't believe people have a right to be crazy, which really means if I think you are crazy, I am legally obligated to treat you with whatever treatment I see fit, which is, again, coming from a psychopharmacologist, not the best thing to be hearing.
Well, I suppose people have a right to be crazy as long as they can function. Do they have a right to be hospitalized at the expense of other citizens when they could be gotten better if they took drugs? I don't know the answer, really.
I do respect this guy, though. He doesn't seem pure evil, but there's something about him that just, ticks me off a little. I can't tell. It's just his smile is too big for the subject material.
Now, I think the general reasoning there has been that if a person is psychotic to the point that they are misinterpreting reality, that then the individual is not really able to make an informed judgment. Now, this applies not only to treatment.
I feel like I want to play that one more time. That was a pretty good quote that I feel like applies to a lot of things nowadays.
That if a person is psychotic to the point that they are misinterpreting reality.
If a person is psychotic to the point that they are misinterpreting reality.
That then the individual is not really able to make an informed judgment. Now, this applies not only to treatment. This applies to making a will, making a contract, getting married, giving testimony, participating in your own defense. So I think that is the instance in which it may be reasonable to insist that the treatment be carried out.
Once you legally allow someone to force a chemical like thorazine or prolixin into someone else's body, then you open up a Pandora's box of abuses of people that unfortunately is the reality that I experienced in virtually every psychiatric ward I ever spent time on.
That's really terrifying. The reality that he experienced at every single psychiatric ward he had time working on. And he says it right here, to force thorazine into somebody's body. That's what they're doing. None of what they were doing was consensual by the looks of it. It was all just, you have to take whatever medicine we give you.
Once you legally allow someone to force a chemical like thorazine or prolixin into someone else's body, then you open up a Pandora's box of abuses of people that unfortunately is the reality that I experienced in virtually every psychiatric ward I ever spent time on.
Researchers are just now beginning to learn something about the drugs and their side effects.
Researchers are just now beginning to learn about the side effects of their drugs.
And it's clear that dosage levels have to be tailored to individual patients.
It's crazy that they didn't know that, but were still administering stuff. Like they were giving every single person the same dose, no matter their size, weight, gender, or anything. That's what I was saying before. They were totally experimenting on these people. And, which is unfortunate. There was no way to actually study mental illness, in a scientific manner, sort of without making experiments. And it kind of seems like that's what they were doing, is they didn't know how to actually treat people, so they were kind of just experimenting with them. That's actually exactly what they were doing. They were giving these drugs to people, seeing the side effects, and then figuring out what was going wrong. They weren't testing them and then giving them. They were giving them to the people as the test. This is just insane.
Some drugs can affect the kidneys or the heart, and sudden deaths because of a previous ailment have happened. But psychiatrists, though physicians, are more concerned with their patients' emotional well-being than their physical well-being, and the necessary tests for tolerance are rarely given.
The necessary tests for tolerance are rarely given. The doctors care more about their mental well-being than their physical well-being, so they're willing to give you a higher dosage of something that might be toxic to your biochemistry because they're trying to treat just your emotions and not your physicality. So they'll give you something that's entirely destructive to your body. It's so insane to be hearing this delivered in like a totally like news report sort of way.
The drugs are medicine, but is mental illness a disease? Most psychiatrists think so, but many others don't. The believers say that there is a biological or genetic basis to mental illness and that there's a cure out there somewhere.
See, that's weird because at the same time, there is a biological mechanism that causes mental illnesses, but there are genetic aspects to mental illnesses, but that's a really slippery slope to start associating genetics with mental illnesses.
They just haven't discovered it yet. Such an approach also assumes that a psychiatrist must be a doctor, because only doctors can treat
a psychiatrist must be a doctor? I'd hope so.
An illness.
It's my belief, which I think I can justify, that in schizophrenia and the affective disorder, there is quite compelling evidence that defects in the mind, in the brain, do exist, and that the brain is not the same as that of a person who doesn't show these phenomena.
You know, illnesses are basically something which can be diagnosed by physicians, where there are reliable tests which can be utilized to determine the nature of a problem, and then some sort of rational treatment can be instituted, and then you can follow the success or failure of the treatment by some sort of standardized means. None of that really holds true when you try to carry this over into psychiatry and analogize from a medical model into emotional problems. Now, I would prefer to use terms like emotional problems.
See, I feel like that is a very enlightened thing that he just said, that in most medicine, there is some very clear, tangible way to affect a medical state of something. You know, if your arm is broken or if, you know, you sprained your ankle, like there are physical things that you can do to improve your recovery and to improve your state. And people apply the same logic to mental health, that you can actually just take something that will make you happy or make you not depressed or anxious. And I think he's kind of hitting the nail on the head. I mean, he is a psychiatrist, so it's good that he understands this. It's crazy how that lack of understanding was kind of the like pervasive force throughout the mental institutes at this time.
Emotional problems. Now, I would prefer to use terms like emotional problems, emotional distress, mental distress, but to stay away from the term illness or disease, because there aren't any tests that people can agree upon as how to decide what it is. It's the sort of thing that distress seems to come and go, whereas illnesses, you know, they're either diagnosable or they're not. And I think the concept of illness and disease in psychiatry has led us down the path to some very, very severe abuses.
Despite the uncertainties about whether madness is an organic...
And it's so funny that they only refer to it as, you know, madness. They don't have any more accurate language besides insanity or craziness or madness. At this time, there is no greater understanding that these are all separate symptoms, that schizophrenia is different from, you know, autism, which is different from anxiety. To these people, these were all just mental illness. These were all just some sort of affliction. And again, you can see that reflected in how they were treating these people.
Reaction to the problems of living, psychiatrists feel they have to do something to relieve human misery. Drugs are one kind of treatment, electric shock and psychosurgery are others.
It's just crazy that those were the three tools of psychiatrists: drugs, electroshock therapy, and surgery, like brain surgery, not even heart surgery, like actually head surgery. Oh my God, like they're showing it right now. Like, I don't know that much about psychiatry, but I don't think those are the 3 pillars it stands on today. But maybe you guys can let me know in the comments. Oh my God, they're operating on this guy's brain. Oh, that's the end of it too. Wow, and it ends on that painting. Again, can anyone please find that painting? Oh, end of part 1. Interesting. If you guys enjoyed that, let me know, and I'll try to find a part 2, but I can't make any promises. But that was Madness in Medicine. And I'll say I'm not all that interested in this sort of subject. I'm more into outer space and nature and stuff, but just seeing these stories being told and the abuses that took place, it is mind-blowing. And again, this is part of the value of rewatching old programs like this. I never would have watched, a YouTube video on that. I can't even imagine what a YouTube video trying to cover the same topics would look like. I don't think there is any YouTube video like that. And now there is. Now you can go to YouTube and watch in full Madness in Medicine and learn about and see the abuses that have taken place in the history of studying mental illness. That really is what we just saw, is the very beginning of us learning how to treat mental illness, which I know that a lot of abuses took place, but also it is a scientific process. And after all that suffering that was caused, I like to think did help inform our current practices when dealing with mental illness. So it's difficult because on one hand, they were kind of just torturing people that were just anxious and suicidal. But on the other, we learned that doing that is bad. So I don't know. I don't know if this was really justified or necessary, but this was definitely an eye-opening watch. So I'm glad to have watched this, and I hope you guys learned a lot too. So let's fade to black.